Okay. So I will apologize for one thing in advance that today my throat is real bad. It's a strange kind of itching and uncontrollable cough actually. So what I will do if I cough or interrupt during my speech, I'm apologizing in advance. Thank you, Fatma. Voice is clear. Okay. So we can start now. So students, today is like you are having 1 week uh, till the exam date, which is okay, which is 16th January. So if you are taking exam on 16th January, you have like few days left. So these few days, they need a very proper planning. They need a very proper revision plan that will make you prepare for the exam. And if you have studied for 5 to 6 months, and if you do not utilize these 5 to 7 days right before the exam, I will say that it will be very risky. So let's plan together how you should prepare yourself in the last week of your examination. So the first thing which students deal with, and actually it's very difficult to deal with, this is the anxiety. The students are dealing with high level of anxiety and stress at this time. And I have some tips, I have some strategies that you will follow, and you will avoid falling into the trap of this anxiety. Why you need to why you need to avoid falling yourself into this anxious stage? It is very important that if you want to learn well, if you want to make good concepts, your brain should be cool and calm. So, how we will tackle this stressful time, how we will tackle this anxiety, we will think about this thing that from where this stress is coming. Okay. At this time, we will think that from where the stress is coming. So, the stress is coming when you are thinking that you are not prepared well. Okay. If you think that your preparation is not good, you will feel anxious. We are fixing these issues also. This is very challenging that you understand what is the cause of your stress and then you fix it. The second thing is that you think and you feel anxious is that others are doing better than you. Okay. Students think this way. So, how you will fix it, we will discuss. Many times, students think exam will be difficult. And a lot of times students think that you will forget whatever you have studied. Okay. And a lot of students, because we are all, hello, Dr. Chaman, we are all postgraduate doctors. We are already specialists in our fields. So we are not teenagers. So students think, my students think that now they are aging, now they are old, so they cannot memorize stuff. So let us fix it one by one. If you are feeling, if you are facing difficulties, like I have summarized the difficulties, I have summarized the points that from where this stress is coming. If you are facing one of this challenge, you can fix it easily. Okay. You are the one who is treating very complicated diseases for the patients. So why can't you fix the problems you are facing? It's very easy. It's very easy for an intelligent person to think from where the anxiety is coming, and then he can fix it. So if you think you are not prepared well, if you think so, then you should listen to yourself. Okay. At this stage, if you know that this book is necessary to read, this question bank is necessary to read, and you are getting guidance from the seniors, you are getting guidance from the mentors, and you think that from after any bad event, due to any certain reason, you are not prepared well, then you should think about your decision of taking exam. If you think you are not prepared well, you can delay your exam. But if you are preparing the main things which are given in your course, you are prepared well with the theory book, you are doing the SPS daily, and For an average person, if you are preparing from 2 to 3 months, then you are good to go for the exam. So assess yourself first and do not doubt your assessment. It is not a wise decision to just enter into the exam and take it and fail it. Make a wise decision and follow it. Students who are studying in the group, they start thinking that others are doing better than them. Okay, this is a very common problem. Dr. Chaman is saying she is unable to revise, so we can talk about it that how you will revise this stuff. Okay, Dr. Chaman, relax. So if you think that others are doing better than you, then I will tell you it's not a race. It's not like RCOG is giving 1 degree to just one person and you are competing others. It's just you are taking your own exam, you will solve your own 200 questions and you will get your own score. So don't worry if any student who is answering a lot of correct questions. Yeah, students are picking up the number 2 and 3 for me. And Dr. Ramna, yes, if you can pick out the cause of the anxiety, you can fix it. So students, if you are reading in the groups and you think that one person is giving all correct answers, he or she is solving all biostatistics question correctly. Oh my God, that person is very genius. My preparation is not enough. Okay, this is the stage where you need to not to compare yourself with anyone. Okay, if there is a particular student who is studying very well in the group, then you should only get inspired from that student. Don't feel bad that other students are preparing well from you, because everyone is gonna take his own exam. Now when you are thinking that exam is difficult, okay, exam is difficult. I'm not saying that exam is not difficult, but exam is difficult in a certain way. I keep telling students that RCOG wants you to take the exam and they want you to pass the exam. Okay, this is not an examination body which is calling the students that come take the MRCOG one and we will fail you. They're saying come take the exam and we will pass you. So how they structure their exam? They ask difficult questions also. They ask those questions which you have not studied in the books. They ask but one by third. In if you say out of hello Dr. Baba wassalam, so out of 100 there will be 20 to 30 questions which will be difficult, but there is a good news also that there will be average and very easy questions also. So if you see that 20 to 30% difficult questions will not make the whole examination difficult. Actually, it's an easy examination. If you say average portion and easy portion of the exam is like 66%. So one by third portion is difficult. Yes, it is, but it will not make your whole MRCOG1 examination difficult. It is a doable exam. It is an exam for which if you study good, if you study good, if you study under guidance, you can clear it easily. Now comes another thing, and students are saying that point 4 is for me and point 2 is for me. So okay, great. You are picking up where you need the help and where you need to fix yourself. So this thing, you will forget what you have studied. Okay, I will also forget. Everybody can. Nobody has an IQ of like 150 or 170. So there are always a few things which we can do to not to forget the important things. So what we do revisions. Okay, we solve questions. If you feel you will forget what you have studied, start solving questions about it. And another very important thing is that study in the group and make a debate. Start a debate. If Dr. Baba is studying in a study room of med exam, um, okay, Dr. Baba, we will talk about it. The revision plan for these 5 to 6 days is already shared in the study room. Everyone who is joining the workshop, you can see that we are preparing important topics very well. And we will keep on studying this way for the coming 5 days. So don't worry, you can revise all important things in 5 to 6 days. Don't worry. So, Dr. Baba, if I suggest you that you are thinking that the topic of molar pregnancy is very difficult for me, so if you just go to the study room and write, uh, come students, come my friends, uh, how about discussing some important points about molar pregnancy? And the students will come, you have friends in your study room, Dr. Baba. If Dr. Chaman is there, if Dr. Purat is there, if Dr. Luzine is there, they will come and they will start commenting on your post. So what will happen? You will read those points and you will never ever forget that. Okay. So group study, revisions, and solving questions about a particular topic is an important thing. And after that, you will not forget what you have studied. Okay, we have Dr. Ashrita. Dr. Ashrita, Dr. Arshita is saying she's not a postgraduate. She has 6 months experience and planning to join in UK. Okay, you don't have much experience. Dr. Baba, no, sorry, Dr. Ashrita, no one is asking for OBS and gynae experience in MRCOJ1 exam. So why you are worried? No one is asking for any kind of experience. Actually, when you are experienced in your clinical side, and then taking exam is easy, but then there is an advantage for fresh graduates that they are not working under pressure. They are not working like 12 to 24 hours in OBS and gynae, and they can study very well. So this is not a problem if you are thinking that you are a fresh graduate. That means you have enough time to prepare. So are you taking January exam? And if you need help, please team, can you send the link of the workshop to this doctor so that she can revise all the important points before exam. Yes, you need to take leave, Dr. Mary. Please take leave if you can. If you easily can, you can go for it. Uh, then this comes the aging thing. So I have a doctor. Uh, I feel she is my inspiration. She is like 47 years old and she has done like 4 to 5 degrees from different boards. And I'm very, very much inspired from her. And she's 47 years old. So there is no such concept that your brain is aging. Your brain is getting golden and golden day by day. If you are making good concepts, you will never forget them. And one thing is that when you feel something is boring, if I feel that the topic of renin-angiotensin system is very much boring and I don't want to study it, but then I have to study it for the exam only, then I will not be able to memorize it easily. So make the things interesting for you. How you can make the things interesting? You can take help from the images, you can take help from the internet, you can watch a video on that topic, and you can again discuss that topic in the study room. So make the things interesting for you. There is no such thing that if you are aging, you will be forgetting things which you study. Okay. Dr. Minaza is about to say something. Please, Dr. Minaza, you can share your thoughts. And doctors, these are 5 points which are making you anxious. And if you handle them properly in the last week of your preparation, you will never ever be anxious. And you have to give yourself reasons. Why are you anxious? Then you have to fix it. I keep on telling students that you are not only a candidate of MRCOG, when you people are wonderful doctors, you are working in hospitals and you are fixing other people's problem daily. Someone is coming and saying there is like I'm here, and if I ask, hello doctors, you are all doctors, I'm a non-medical, please give me advice that my throat is itching very bad today, so what should I take? So no one amongst you will say, oh please don't take anything. You have a lot of suggestions. You will give me medicine, you will check my throat, you will find the cause of this itching, and you will tell me that this is the disease from which you are suffering, and then you will treat the disease, because doctors has they have this thing into their minds. They find the cause and then they fix it. So these are the causes which are bothering you, which are making you anxious, and now you know the causes, and then you can fix it easily. For every day, please can you share topic in advance for a particular day discuss we have to revise morning before class. Doctor, if you're talking about the workshop, I would say that I try to cover all the important topics, but I cannot, predict that which topics we will discuss today or tomorrow. And this will be like a pressure on me also that I have to cover all these topics in this particular day. So sometimes I find a topic which is very important, so I share it. And you can see that we started spermatocytogenesis, etc. today, and then we related our knowledge to the oocytes, the formation of oocytes. So we will go this way. We will relate. We will interlink the things. So fixing the topics for a day is actually not a good idea. Yes, you will find normal ranges in the exam. Dr. Gojlan, the webinar, I will try my best to cover it in 1 hour. Okay, so so 1 week before exam, let's do our wrap up points. You should prepare short notes for revision. Short notes, this word is very important. They should be really short. If you keep on writing the stories for you, you will not be able to revise them. Make them short, make them concise. Okay. Someone from Galaxy is saying that I'm 60% prepared for the exam at this moment. What should I do? Should I withdraw? Okay. And doctor, the passing percentage is around 70%. If you think that you are 60% prepared and it's your feeling, that means I think you can do better than this and you will pass exam, inshallah. And you should take it. And in this 1 week, revise everything you have already done. And again, I'm suggesting you that take 1,000 important topics and 1,000 important questions workshop so that you revise all the important things and then you are good to go for the exam. 60% is a good percentage. If I think I'm prepared 60%, I will definitely go for exam. So good luck. So making short notes, no new books and SBS sources, no new books. If someone is getting subscription of a very fancy SBS source, you should not think about that. Okay. Okay. Doctor, can you please write your name because I would love to interact with real persons. And I've told you that study in the groups. Studying alone will, make you more anxious. And there is a very important tip that you should not think about the result. Every time we're preparing for the exam, this is our psychology that what we think, oh, am I able to pass this exam or not? Like this person is saying that I'm 60% prepared. That means he is predicting that I can get 60% in the exam. That means he is predicting that I cannot pass this exam. So do not think about the results, only think about the preparation. Are you done with some important SBS sources? Are you done with some important topics or not? Think about these things. Do not think about the percentage which you will get in the exam, okay? Thank you, Dr. David. I'm also welcoming you in the webinar. This weightage thing is not revealed by MRCOG, RCOG. They do not tell that how many questions are equal to what, but they tell you that there is no negative marking, so you should solve all the questions, all 200 questions you should solve. Okay, Dr. Sheena, Dr. China, in both ways, your name is beautiful. Okay, Dr. Baba is asking an interesting question. If somebody has only done the SBAs and the topic test and the mock test and not all the past papers, is it okay? This is very interesting that you are telling me that you are done with like 90% of the syllabus and you are asking if it is okay. It's more than enough. Okay, just revise now. Passing percentage is 67, around 67, 68. It is also not fixed. Dr. Ashrita is saying that she did the topic test. Okay, good. Other than topic test, Dr. Ashrita, you have your live sessions and then you have your workshop. So revise both of the things in this week and you are good to go for the exam. Okay, because in the study room, I cover all the sources. And Dr. Mary, Dr. Baba, a lot of prayers for both of you. You people will clear the exam easily. Thank you, doctor. So some more tips for this week. Don't forget that you are already a successful person. A lot of people are commenting in the chat box. So how many of you think that you are already a successful person? And why? Why I said that you are already a successful person? People are saying Alhamdulillah, and this is the best response I've got from Dr. Amna. Alhamdulillah, we are already a successful, we are successful people, and we are the source of inspiration for others also. So at this stage, we should not forget that we have already um, got through a lot of difficulties in our lives. We are done with the difficult most examinations of our medical school. So this is another this is another achievement, and we can easily do this. Dr. Salma is saying, Alhamdulillah, I'm a successful person. I've passed FCPS Part 1 in Gynaeops with 2 kids. This is an achievement, Dr. Salma, and I keep telling you that you people are inspiration. You people are an example for your children also. Okay? So if you are working, if you are raising the kids, and then you are studying, I can't tell you how important it is for you to understand that you can't underestimate yourself. You people are wonderful people. Okay. And the ultimate goal for any student who is taking MRCOG 1 is that you are becoming MRCOG. So you have to take all 3 parts. And if in the first part you feel low, you feel down, that's fine. You have the right to take a break, you take a rest, you eat something which you like, and then you study again, and you keep on studying like this. So I have this wonderful formula. I say I have invented this formula because I'm a teacher and I keep interacting with the students. So this came into my mind that you have to do this pause, run, pause, run, pause, run formula. What is this pause, run formula? Anyone amongst us cannot run for the whole day. Anyone amongst us cannot study for the whole day. So take pauses. When you are feeling low, when you are feeling down, do not think about the result. Do not think about the decisions you are going to make. And do not think about anything. Just give yourself a pause, like 5 minutes, 10 minutes, 15 minutes, 30 minutes. That's fine. And then think about the study. And then with a positive energy, you should go for it. So Dr. Baba is saying, I've not allowed any holidays out of work, still struggling with my course, and Alhamdulillah. So the last word is she is still very happy with the preparation and thanking the God uh, because, after all this time, Dr. Baba was a person who joined the regular course like 4 to 5 months before. Am I right? So in these 4 to 5 months, she studied every day. So great. She's saying Alhamdulillah because every day she got up and studied and made it towards the exam. So I'm sure in the exam she will get good scores. 24 hours I'm thinking about the exam. Okay, great. If you just carefully turn the thinking towards the preparation and not the exam, you are good. Yes, Dr. Baba, the study platforms are made for this purpose. And during examination, what you have to do. That's fine, Dr. Chaman. If you are not getting any off from the work, you are still going to take the exam. That means you're a great person, you're a brave person. And sometimes I don't think students need vacations or off or holidays for the preparation. They are already doing best they can do. So how to start? And actually, I want to share my example. For the examination, I applied for holiday for a week, and I was sleeping more than usual. I was eating more than usual, and I was taking a lot of rest. And I started watching movies, and I was watching season right before the exam. So I thought, no, this is a big no, that you sometimes you don't need holidays because holidays you make them fun holidays. So if you get up in the morning, you will sleep early. If you have to get up in the morning, you will sleep early. And if you know that after attending the work hours, you have to study, so you will be very active and energetic for the whole day. And I have seen this thing that if I get an off day for the examination, I'm a very lazy person. Dr. Kurat has forcefully taken off from the work. So how many people you were fighting with? Tell us. Because sometimes I can't take forceful vacations. Yes, Dr. Mary is saying that she discusses things with interns and medical officers, and going to work keep people more active than the ones who are staying at home and studying. Yes, this is the motivation session, and I have a lot of positive things to tell you. And the tension, it will be gone after this session. My students will not feel anxious. So we will discuss some more things, that how will you solve during examination the questions. And sometimes I have seen that students prepare so well, but in the examination, they start feeling anxious, and they completely lose their mind and they mark incorrect options. So for like 4 to 5 minutes, I will not read the chat box, and I will tell you the answers of these questions. So how to start solving the questions? You have like 100 questions in the first part, and what you will do, you will solve all the easy and all the obvious answers which you know 100% that you are marking correct answer. So it will be the first round. And in the second round, you will solve the biostatistics questions and charts and images and pictures. So this will be the second round. And in the third round, you will solve those questions which require you to like think about the answer. So prepare, solve the questions like this. Then what you will do, like students are saying, they will forget things easily during the examination. They think this way actually. They should not. So what you will do, if you cannot solve a question from a topic which you have already studied, at this point, if there is a question like from gut anatomy, and you studied the topic like 1 week before, and then question comes and you are unable to finalize an answer, don't feel low about it. What you will do, start excluding, start excluding the wrong answer. Just 1 minute. So I'm very sorry for this interruption. It's a very bad flu and cough, influenza kind of virus these days, and it's hitting me very bad. So start excluding the wrong options. So you will think about the topic, you will think about which option is wrong, and then you will exclude that. And what to do if you get a question from a topic you have not studied at all? Then you don't have to worry about it. Then you will again start excluding the wrong options, and then you will like mark one which you think is better, and do not overthink on that question, because those questions will be like 2 or 3 or 5, not much more. So don't overthink about them, those questions, and do them in the third round. And don't think that you cannot answer them correctly. Sometimes if you just guess, if you just make a guess, sometimes if you are lucky enough, it can go correct. Okay. And there is a very important thing, and Dr. Mariam is here with us, and she is our old student also. She is a mentor in the med exam also. She took the exam in September, and she will also tell you that how you should spend the rest hour. So a lot of students, they what they do, they get the mobile phone and they start talking to their friends. Oh, are you done with the first round? Please tell me what were the questions, what are the answers, what they are asking in the part two. And some students, what they do, they open the books and they start revising. This is not a good thing. Just eat a sandwich, eat a candy, eat a chocolate, and prepare yourself for the part two. Um, Dr. Shangiri is asking how to go about when we face to choose between two answers, sometimes with tricky questions. I'm telling you that there will be tricky and confusing questions, but not many more. Like there will be 10 to 15. So think about the answer, and there can be two correct answers also, because we are dealing with single best answer (SBS). We are dealing with SBS, single best answers. So in the exam, you don't have much time to spend on one question only. So if you are confused between two answers, go for the one which you think which is best. Okay. Mm-hmm. I told my hospital in charge that whether you give or not permission on vacations without your permission, okay, you are PPSC. Dr. Kurat, okay, it was good that you got the vacation from the hospital, but in some hospitals, in some settings, they do not allow their residents and their doctors to go on the vacation so easily. Thank you, Dr. Mary. So, Dr. Mariam, can you please add some words to this thing? How students should spend the rest hour, and how was your experience during exam? How you kept yourself so calm that you got 92%? And I'm again very much amazed that Dr. Mariam got this high score. So, how you managed to get 92%? Please tell our students.
Hello, how Dr. Marish?
Hello, my
Hello.
wonderful friend, Dr. Mariam is here.
Thank you so much for the wonderful introduction. Okay, so you were asking that what was my strategy for the exam day, and you have also asked for the rest time between the two papers. So my strategy was, because I was prepared enough, alhamdulillah, and before the day of exam, I slept at around 10 a.m. Sorry, 10 p.m. And then at the exam day, my paper was around 11:30 a.m., I guess, and I was there at the exam place around 10 a.m. because my exam was to be started on 11:30. And at exact 11:30 my exam started. That was paper 1, and it was consistent of 2.5 hours. And but if you think that you are very prepared, well prepared, then it is just a game of minutes. And I did my exam in around 50 minutes. That complete 100 question, I did it completely in 50 minutes. And after that, um, I talked to the invigilation that I want to go outside, but I was not having any of the study material. I was not having my mobile phone, and I didn't ask any of my friend and any of my colleague that how was your paper 1 and what was the answer for that. I just completely rest all the decision to Allah. Okay, and then when I was outside the examination room, basically I went there to have some water, to have some snack, just this kind of thing. And after 10 to 15 minutes I was there again in the examination room, because the invigilation team advised us that it is totally up to the candidate if you want to take the next paper right now, or if you want to take the next paper around the break of 1 hour. So it is totally up to the candidate, whatever option want you take. But it is restricted to some of the centers. I was appearing in Multan center, so it was strategy there. I don't know about other city center what is their strategy, but one of my friend appeared in Islamabad center, and it was the same like the Multan Center strategy, that she was given paper to after 10 to 15 minutes break. So it is not advisable to take a lot of books with you and take a lot of study material with you, and you think that you can get revision here there in the examination center. It is just totally a mess. So please don't do this. It is not a very wise plan to revise there. Whatever you have studied, whatever you have in your mind, it is enough for you to appear in your exam. So is there any other question you can ask me?
Yes, it's a wonderful chance. Dr. Mariam is here and you can ask your queries about the recent pattern of examination. And Dr. Mariam has told a wonderful thing and a very interesting thing that things are not same in all the centers. Some centers are giving you a good enough time for the rest, and some are calling you for the other part. And I would like to ask one question, Dr. Mariam and all the students. What would you like to eat in the rest hour? What do you want to eat in the rest hour? Samosas. Wow. You want to eat samosas? Okay, nuts. Something sweet and protein shake. Okay. Tea. Yes. Tea should be there.
Yes, tea. Yeah. Tea is the wonderful option.
Dr. Kurat will eat fries. Dr. Salma will eat chocolate, tea and nuts. Fried items. Yes. So, students, you can take these things with you. Desserts. Changeri wants desserts. Okay. We have some queries with Dr. Mariam. I can tell you that Dr. Mariam is an admin, is an owner of a public guide group on the WhatsApp. You can ask all these queries for the rest of the days directly to her in that group. So, Fatma, please share the link of ACE July. Dr. Mariam is organizing daily sessions for July batch, which is the coming batch after the January exam. So please share the WhatsApp group link with the students, and the rest of the questions you can ask directly from Dr. Mariam. Um, okay, a lot of questions, Dr. Mariam. But again,
Yeah,
I will tell you,
I have
students,
seen in the comment box.
every time they take exam, they ask different questions. Not every time they ask a lot of pictures, not every time there are a lot of biostats question. Every time exam is different. And this is one thing which I want to tell you, and this is very important to know. And Dr. Mariam will also tell you about it, that you may get similar questions. Like you are doing the recalls, and then you attend the exam, and you have just crammed the keys and you are not done with the whole topic, and you have not made the strong concept about the topic, and they can give you similar question with very minor changes, and this is a trap. So this is very important that you study in a way that you don't fall into this trap, and you get the good score. Okay, so this is the thank you, Dr. Mariam, for making time for us, and you explained everything so well, that I also am feeling that exam is like really an easy thing to take, and if you just don't get stressed unnecessarily, the last part of your preparation, the last week, it also can go very well.
Yeah, exactly.
Yes,
It
Dr.
was.
Nigar, you can skip the question, and I've told you that you should solve the questions in 3 rounds. That means you can skip them and then you can back and you can solve them. So join this very active study group, and for the rest of the days, you can clear your queries easily. Surgical instruments. No, no. I've told you, do not start new books, do not think about unimportant topics, and do not start reading about the new and unimportant topics at this time. That's great. So this was the first part of our webinar, and it took more time than I was thinking. So now we can start with the educational topic. we want to read today, and that is autosomal recessive and dominant inheritance. So, after this webinar, what you are able to diagnose, you are able to diagnose an autosomal disorder, and you will be able to differentiate between recessive and dominant autosomal disorders. So it is good that you just pick up a pen and a notebook, and you will be making concepts here. So this is the question number 1 in front of you. You can write the answer in the chat box also. You can write the answer with you. So question is very easy. What are the autosomal and sex chromosomes in human genome? So please give the answers. So we do this concept building thing, and then we will make this very complicated, very difficult topic very easy in like just 20 minutes. Okay. So what are the autosomal and sex chromosomes in the human genome? So firstly, you should know how many chromosomes are there, and then you can differentiate between these two. Okay. Chromosome number 1 to 22 are autosomal, and then comes X and Y, which are sex chromosomes. And this is the normal human genome. Autologous, autosomal, yes. Then comes the question number 2, and I've given the answer also. Sex chromosomes in males and females. This is XX in the male, in the female, and XY in the male. So we are revising very simple things. Why? Because we are doing this concept building thing. So who will tell me that autosomal chromosomes, are they same in the male and the female, or are they different, like the sex chromosomes in male and female? What do you think? Because male and female are from same species, so what is the difference between the male autosomal chromosomes and the female autosomal chromosomes? Okay, I've got a lot of correct answers, and everyone is saying that all males and females have similar autosomal chromosomes. So that means if there is a disease, which is related to autosomal chromosomes, it will be same uh, for the males and the females. Okay, so males and females have equal chance of inheriting an autosomal disorder. Okay, but it is not true for X-linked disorders. It's not true for mitochondrial disorder. Then it is not true for Y-linked disorders. Just 1 minute. Okay, now I have some important questions to ask. Please tell me, what is the carrier state? What is the carrier state? What do you mean by a carrier? Let's go towards the literal meaning of the word carrier. Because every time we dig out the literal meaning of something, just the literal meaning, Dr. Aisha, what is the meaning of a carrier? Okay, I'm getting some good answers. Not expressed in phenotype. This is very comprehensive definition of a carrier. Disease present in genes only. Okay, good. Can transfer the disease but not affect it. This is also a good definition. Shingeri is saying inherited from one generation without expressing the disease. Good one. And Amna is saying carrier is one in which disease is not expressed. And the best answer is that can carry gene. Which gene which is disrupted. So students, I have another answer. I have another question from my side. Do you think that carrier state is related to dominant conditions or recessive conditions? This carrier state is related to dominant or recessive conditions. Recessive. Mary is also saying that looks normal but can carry disease. Very good. Normal phenotype, abnormal genotype. This is also a good one. Recessive, 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 recessive. Well done. So now if we are talking about dominant diseases, no one will say there is a carrier. And if there is a carrier, no one will say that this is the dominant. So recessive state, carrier state recessive conditions in autosomal and in autosomal inherited disorders. So now we have fixed two important things, two important concepts, that carrier is the one who has a normal gene, but he is not showing the disease. Carrier is the one who is carrying the disease with him, but is not showing the disease. His phenotype is normal for that disease. And the carrier state is generally seen in the recessive conditions. So now if we go towards the literal meaning of this thing recessive, if we talk about the meaning of recessive, that means something which is not dominant, which is the opposite of the dominant. And the literal meaning of dominant we have already discussed. Students told me that dominant mean powerful, strengthful, showing itself, and the one which is pushing others behind. So dominant will be the one who will definitely show itself, and recessive is the one who will not show itself. So now if a student among the candidates help me, and how he will help me, he will give me some rest and he will read this slide. So what will happen that you will get to know how autosomal dominant and how autosomal recessive conditions are different from each other. So who will read this slide? Okay, Amna, yes, you can.
Autosomal dominant conditions are caused by disruption of only one gene of a gene pair. The children of individual affected by an autosomal dominant condition have 1 in 2 chance of inheriting the disrupted gene. Okay. Autosomal recessive conditions are caused by disruption of both genes in a gene pair. Where only one gene is disrupted, the individual is known as carrier and is healthy.
Okay, great. Dr. Amna was real quick to read this slide. So let's make some more concepts. Here, I'm writing 1 and 1. Okay. This is the pair of chromosome in one person. And one of this, one chromosome is defected. So every time this person is producing children, every time there is 50% chance, 50% or 1 in 2 chance of sending this defected chromosome into the children. Okay. So this is how this dominant disease works. Every time they are producing a child, there is a 50% chance that they can send the disease into the children. But this is not true for the recessive conditions. What happens in the recessive conditions? Just 1 minute. Why I can't write it? Okay. So if there is chromosome number 1 and there is the other friend of the chromosome number 1 present in the same genome, and this one is defected, the person will not show the disease. The person will not show the disease. This person is the carrier of the disease. So where only one gene is disrupted, the individual is known as the carrier and is healthy. But if the person is getting both genes disrupted, then he will show the disease. So learning this difference is very, very important. Okay. So let's move towards the next slide. What you are looking at, you are looking at the patterns of the inheritance. Here comes the dominant. There is an affected parent who is showing this mutated gene. Okay, this gene is affected. Every time this person is sending this gene into the children, it will affect the children. Okay, and again, the thing we decided, there is no difference between genders. Both parents can get affected, they can affect both genders. But what happens in the recessive conditions, there is a carrier parent. Carrier parent is also sending the affected gene into the children, but again, the carrier parent is making the children carrier. And if there is a chance that both of the parents are carrier, there is no unaffected parent, both of the parents are carrier, then they will affect the baby. How they will affect the baby, we can see in the coming slides. Students, if you make a good concept for this thing, it's very easy to remember and solve the pedigree charts. So we have this one parent affected thing, autosomal dominant inheritance. This slide is very important. You can see that there is something written 25%, 25%. So if one parent is affected with the dominant inheritance, there is
Adil कैसा है?
there is
मुश्किल था?
25% chance. Please turn off the mic, doctor. Who has this mic open? Please. Okay. So every time one parent is affected with a dominant condition, he is producing one normal son, one normal daughter. Okay. Then one affected daughter and one affected son. So 25% chance if we talk about the gender. And if we don't talk about the gender, then it will be 50% normal and 50% affected children. Okay. So we will keep it very simple. Child gets a dominant gene, child is affected. Child gets one recessive gene, he is a carrier. Child gets two recessive genes, he is affected. So take a picture of this slide. Okay, take a picture of this slide. And this is actually the extract of all the discussion we have just made. Okay. Are you following the discussion, doctors? All good? We're good to go to other slide. Okay, Dr. Javeria, very good. So now we can discuss it more. This was an autosomal dominant condition, and there is 50% chance if parents are not healthy, if parents are suffering with an autosomal dominant condition, there is 50% chance of transferring the disease. But in autosomal recessive conditions, if they are both carriers, parents are both carriers, they will make their children diseased. Now there is a very good comparison in the form of this table. You can see we have this comparison within the dominant and the recessive conditions. So we will read the points and we will see if the table is justifying these points or not. So there's the first point, a lot of affected individual. So are you seeing in the table? There are a lot of infected individual. All generations are affected. If the parent is affected, he is making the children affected. And if parents are healthy, they are not transferring the disease to the children. And this is true for the dominant conditions. Then they're saying that males and females are equally affected and disease also can be inherited from male and female both. Both parents can affect the children. Disease cannot be inherited from unaffected parent. This is the part. This is the part, okay? If there is no disease in the parents, there is no disease in the children. But if there is the disease in the parents, it is definitely transferring into the children. So we call it skipping of generation. There is no skipping of generation in the autosomal dominant condition. But in the recessive conditions, you can see there is skipping of generations. Parents were healthy, they were not showing the disease, but there is a child who is not healthy, who is affected by the disease. That means the both of the parents were the carriers. There is skipping of the generations. Males and females, both genders can be affected because this is autosomal condition. Inheritance can also occur from both male and female, and disease can be inherited from unaffected parent also. So take the picture of this table also, and this is very important for making a good concept. Okay, when you are done taking the picture, just tell me. Okay. Done. Good. So these are some examples of autosomal dominant and autosomal recessive conditions. Cystic fibrosis is the most important amongst the autosomal recessive conditions, and amongst the dominant conditions, breast ovarian cancer susceptibility, BRCA gene pattern of inheritance is the most important and common one. So let's do this thing, solve this pedigree chart, and I will help you. There was a parent. Let me do some drawing here. This is the parent number 1, this is the parent number 2. And they produced these children. Okay. These are not the children of these parents. So one thing which is obvious is that if parents are healthy, they are not transferring the disease. Second thing which is obvious is that there is no skipping of generation. Third thing is that in second generation, this is one, this is second. In second generation, both genders are affected. Same goes for the third generation. Both genders are affected. There's no certain pattern that only females are getting affected or only males are getting affected. So a lot of correct answers, and I'm really loving the correct answers. Autosomal dominant. So this is the chart for you. Please write down the answers, and I will be okay. I'm back with a lot of correct answers. Skipping of generation, yes. Both genders involved, yes. There are carriers because they are not showing that they are diseased, but they're transferring the disease to the children. So this is the perfect representation of autosomal recessive diseases. And students, I'm very much sure that if you have understood all the points given in the description of autosomal inherited disorders, you can solve all the pedigree charts, which I will give you in the workshop and in the exam. This is a good news actually, that they do not give complicated and a lot of generations, a lot of diseased people in the charts. So the charts are very simple in the examination also. Yes, doctor, the lecture is recorded. Recording will be available in like 24 hours on the YouTube channel of MedExam. So doctors, what we are doing, we are conducting this 5 days workshop. It has already been started. I shared around 20 questions, and I shared the questions in a form that students are reading the explanations and they are learning the topic very well. So anyone amongst the students who is already a part of the workshop, will you please tell me how this is going? Actually, this is just the start, and it will be full of knowledge. It will be full of energy. Thank you, Dr. Chaman. So join the workshop. If you think that you are 60% prepared, make it 80% in just 5 days, because you are getting 1,000 important topics to discuss in the group, and you will be solving 1,000 important questions also. Thank you, Dr. Saad, and I'm glad that a lot of students joined the session. Okay, Dr. Hira. Dr. Hira, you solved the 20 questions which I have shared. Actually, more than 20, I guess. Yes, okay. Dr. Shazia, for extreme disorder, we have already done a webinar, and I will share the link of the webinar with you. Thank you, doctors. So we are good to go with this knowledge in autosomal inherited conditions. Thank you so much for these kind words. How can you join the workshop, Dr. Zainab? You can join the workshop by the help of Medexam expert team. And thank you, Dr. Shangeri, saying that workshop is super cool. Wow. I like this word, super cool. Answer can be checked immediately with explanation given below is very, very helpful. Yes, it's very, very helpful. It's the best way to learn because at this time you are not able to search for the answers. So I hope the session was useful for the students, both in terms of the educational topic and the motivation. It's fun to see cute stickers. Yes, I love to share a lot of cute stickers because it keeps the boring environment of the workshop very chill and cool. Thank you so much. I will be very active with Medexam in my part 2. I knew about you guys in the last 3 weeks of my prep. Thank you. Oh, that's sweet, Dr. David. I'm looking forward that you clear your exam with good score, and definitely in the part 2 you will be meeting wonderful mentors who are best mentors in the world. Dr. Hassan, Dr. Zaid, Dr. Pradnya, Dr. Maryadamala. The team of part 2 is wonderful. I can't explain in words that how wonderful the part 2 team is. So welcome in advance. Okay, team, please share the link of the workshop. Please share the link of the group of Dr. Mariam. Please share the link of the guide groups as well. And now I will be leaving the session so I can just grab something to eat. And then I will go for the rest of the part of our workshop. I also need a lot of energy for sharing 200% each day. Dr. Lazine. Okay, full list. I will share the list in the workshop, okay? Important anatomy, nowhere I discussed the anatomy is the genetics session. Okay, Dr. Lazine, we will try our best to clear the discrepancies. And for some things, for some diseases, we are not sure, but we will try our best to find the best reference. So we are good to go to the rest of the workshop, and I'm closing the session now. Anything you want to ask? Thank you, Dr. Lazine. Anything you want to ask, you can just send a message to our customer support number and we can discuss. Okay, good luck, students. Good luck. Take great care of yourself. See you. Bye-bye.
जी तो मैंने यही कहा ना कि मैंने इसको बताया भी अगर ये अभी भी हो सकता है अर्जेंट तो पैसे भी मैं दे दूंगा इसको।